These are quotes from real people with families just like yours that are struggling to sustain their quality of life and trying to fight against the deficits facing their country. These are people of Zimbabwe, and we are here to help. We are the Student Organization for Prevention and Assistance with HIV and AIDS. We plan to educate citizens in Zimbabwe with prevention techniques and information about the spread of the HIV virus by volunteering health services to impoverished areas, specifically in focusing on young women in Harare, Zimbabwe. This region of Zimbabwe was first colonized under a mandate by the British South Africa Company in 1889 and is located in southern Africa, neighboring Mozambique and Zambia. The official languages spoken in Zimbabwe are Shona, Ndebele, and English. Even though these are the 3 official languages, the country has 13 minority languages. Zimbabwe currently has a population of 14 million, which may decrease if the problems of HIV and AIDS cannot be addressed efficiently. The workforce could decrease to about 20% if there is no prevention of the spread of the HIV and AIDS virus. Harare is the capital of Zimbabwe and is known for having the most cases of HIV and AIDS, which is why we decided to focus here. We decided to spend $386.34 million on the prevention of mother-to-child transmission. In Zimbabwe, the acceptance rate of VCT among the antenatal care clients ranges from 20% to 63%, which is very low. The poor antenatal VCT results from fear of stigma and inadequate counseling experiences. As a result, we plan to spend $1 million in hiring the counselors to give presentations to pregnant women on the benefits of antenatal HIV testing. We will spend $3.9 million in hiring experts to conduct the test, collect and analyze the data in order to give proper suggestions to the pregnant women. Since the mean cost of HIV testing and counseling was $64.17 for a preliminary positive test, we can ensure that 10,000 people receive the HIV test within 6 months. HIV and AIDS can also be passed from mothers to babies through breast milk. Thus, providing formula with clean water is very necessary. However, Zimbabwe suffers from severe water problems. More than 60% of the water supply infrastructure in rural areas is in disrepair, and the water services in urban areas has also been deteriorating. In this case, we plan to spend $380 million on providing the water and sewer reticulation. Then, we will spend $1.44 million on providing formula to newborn babies. In Zimbabwe, a tin of baby formula powder costs $8, and a baby needs 6 tins per month. Our plan can ensure that 5,000 babies has access to formula for 6 months. There is currently no cure for HIV and AIDS, but a combination of medicines could be used to fight HIV infections. This is called antiretroviral therapy, or ART. ART services are predominantly offered through the public sector, with the private sector being an untapped potential resource for ART services for the future. Thus, we plan to spend $100 million as subsidy for private hospitals and clinics which provide ART services. Also, in order to increase the acceptability of ART programs, we plan to spend $8 million on building 10 ART facilities close to residential areas in Harare. For each facility, we plan to hire 5 doctors, 10 nurses, and 20 healthcare workers, and recruit some volunteers. This would cost roughly $9.14 million in total. Lastly, we plan to give $100 million to support ART programs for those 10 facilities. What's more, the increase in patient volume over time has resulted in the need for available human resources to multitask to enable the ART program to achieve universal access. Hence, we plan to spend $800,000 in hiring 2 professional healthcare trainers for each new facility to train healthcare workers to enhance ART services. With this money spent, more skilled and adequately trained human resources would help progress towards service availability. We are going to spend $395.72 million on women's education to provide pamphlets and hire staff to provide information to the patients. There are so many ways that HIV and AIDS are being transmitted, and some of the ways are through breastfeeding and sexual activity. There is a chain effect that leads to the spread of HIV and AIDS in Africa. In the country of Zimbabwe, polygamy plays a strong role in their culture. It is reported that 14% of women are in polygamous marriages. With men being able to have multiple wives, there is a chance that the women can catch HIV and AIDS and later pass it on to their children. We would like to spend $8,690 on computers and $5,000 in textbooks. With these, we would like to educate women about safe sex. This is one of the ways to stay protected from HIV and AIDS and slow down the growing population. If we are able to provide women access to this education, we can help develop Zimbabwe overall. If you give us this money, we will be able to slow down this epidemic. We will provide women with education about how HIV and AIDS diseases are transmitted and the effects of having HIV and AIDS. We are hoping to cut down the spread of HIV and AIDS through this. Thank you.